Hello, dear students. After a long break, I came back with a topic which is reading techniques and preparation for examination in MBBS. And this lecture has been assigned to me for the foundation course students, means the students who are just enrolled in the first MBBS. As such, the name of the topic itself suggests that it is a very vast topic, and here I am going to emphasize only few salient features or the points that are required for the students who are just enrolled in this MBBS. And the learning objectives of this session are: which are the subjects which are to be covered in the each professional year duration and the exam, as well as the internal and university examination, and how to read, how the reading is different in MBBS as compared to the 11th and 12th standards. So this is the academic calendar for the MBBS batch students 2023, 2022-23, laid down by the NMC, and here you can see the professional year, time frame, subjects and the months of each year. In the first year, it has already started from the 15th November and it lasts up to the 15th December 23, and the three primary subjects, anatomy, physiology and biochemistry, which are covered in this for a duration of 13 months. In the second professional year, the duration will remain same, that is of 13 months, and three subjects, pathology, microbiology and pharmacology, are covered in this year. In the third professional year, which is a third part 1, which is of 10 and a half months duration, and two subjects, forensic medicine and toxicology and community medicines, will be covered in this professional year. And fourth professional year, which is the third part 2, which is having the largest duration because of the major clinical subjects like general surgery, general medicine, pediatrics, obstetrics and gynecology, ENT and ophthalmology, are covered over a period of 17 and a half months. And from the 1st June 27, as per the compulsory rotating medical internship 2021 regulation, 1 year of internship will be conducted, and after the pre-PG examination from 1st July 28 onwards, post-graduation will be started. So this is the overall time frame of the MBBS batch 22-23. Now, examination pattern. Obviously, there are internal examination and university examination. In the internal examination, there are two term ending or internal examination and one preliminary examination. In addition to this, there are various term ending exams, system ending exams, clinical posting exams, logbook assessments, all these. It will be carried out in the different professional years according to the pattern of different subjects, and at the end of the year there is a university examination. Now, as this college belongs to Gujarat University, there are certain guidelines for the appearance in university examination and the calculation of internal marks, and the rule laid down by the Gujarat University is that internal marks which are given during the each professional year by the different subjects, they are not counted in the university examination result. So again I am repeating that in your final result, in your mark sheet, the internal marks that you have got in each subject are not counted. But why I am emphasizing this again and again? Because if you just look at this statement, then obviously you feel that then there is no need for getting good marks or preparation for internal examinations conducted by different colleges. But there are certain rules, and that is 75% attendance and 50% of internal marks. Now, these 50% internal marks, both in theory as well as in practical, it means that 50% internal marks in theory and 50% internal marks in practical are required for the appearance in Gujarat University examination. So even though these marks are not finally uh, shown in your mark sheets, but it is obligatory to fulfill these two criteria, that is 75% attendance and 50% internal marks. They are must for appearance in the university examination, and it goes without saying that it is first step is the eligibility to appear, then there is a question of result. So don't please misinterpret that now there is a no weightage of internal marks. Actually the weightage of the internal marks, it has been significantly increased. Here the internal marks, previously that 33% internal marks were required, while now it is 50% internal marks are required. So actually the weightage of the internal marks significantly increased. Now I will tell you one another thing, that's also this is all about the examination pattern, different exam eligibility. Now, as I told you, the teaching learning techniques in the MBBS, it is a very vast topic. That is one thing, and second thing is that there is I one cannot make generalization about the teaching learning techniques, because there are different subjects, different evaluation schemes, and which is not to be generalized in with a specific set of guidelines. So here I am giving you certain basic guidelines, but one thing will remain clear, that long-term memory is must in the medical education. Okay, because if you just look at what is the difference between your 11th and 12th standard, or your NEET examination, and this MBBS course, that here each and every subject, if you just go through the textbook, forget about the reference book, but if you just go through the textbook, the content is so much large that it is not possible to cover a complete subject a day before your examination. So what I want to tell is that you have to build up your long term memory. Okay, it is not difficult. There are certain methods by which you can improve the long term memory. Okay, now how you can improve the long term memory? First thing is that whenever you have learned a topic during a class, you read on the same day, that is a 0 day, that is must. Now here again I am repeating that whatever the topic that is going to be taught in your uh, this class, if you are not going to read that topic after the completion of the lecture, it is not going to be helpful in any way. So always make a habit to read that topic from whichever the textbook you like after the completion of the lecture. And here I want to emphasize one more thing, that even better than this is, if we are always putting a timetable on the notice board, if you just go through the topic before the conduct of the class, whether you can understand or you cannot understand, you just go through the topic before the conduct of the class. It will be very helpful to you to understand the topic during the class. But if you can't do that, you must follow my second advice, and that is read the topic after the completion of the class on the same day. Then the same topic, it has to be revised on the next day. Okay, then now this question can came in your mind that if I am doing the revision of the same topic and then on the next day, how can I get the time for reading the topic of that day? Obviously, on the next day, the time required to read that topic will be significantly less, and this should be followed by a revision after 1 week, and the same should be followed after 1 month. So here there is a rule of one. So you read the topic on the day it has been taken, followed by the next day, followed by the next 1 week, and followed by a month. Okay, this will definitely help you to improve your or to build up your long-term memory. Now, which are the different tactics by which you can improve your long-term memory? There are certain do's and don'ts. First is you develop interest in the subject. Now, one thing I want to make it very clear that it is not like that one or two students they are having a very sharp memory and the other students they are having significantly a less memory. The memory is directly related to your interest, and you can definitely develop interest in your subjects. Say, for example, if in the first year you are going to learn a topic that is neuromuscular transmission, you just think that okay, a muscle is moving. Now, how the muscle moves, there must be some command from the higher center. It means that the nerve impulse passes, reaches and gives signal to the muscle. How the nerve impulse passes, there is a depolarization. How the depolarization, there must be some action potential generation. So you just think like that. You develop interest in the subject, and always make your vision very broad. Whenever you are in the medical science, all the subjects, not only in the same professional year, but across the different professional years, the subjects are interrelated, and you just can't separate one subject from another subject. This is the major mistake conducted by the majority of the students. You are preparing each subject individually. Rather than that, you correlate the topic across the subjects. You just break down the boundaries between the different subjects and you prepare the topic holistically. It will help you. Okay. Then always try. How you can develop the interest? Always try to correlate with the clinical scenario. Say for example, if you are learning the ketoacidosis in biochemistry, in which condition the ketoacidosis develops, in the diabetes ketoacidosis develops, what are the reasons, what are the symptoms in the patients, what are the biochemical changes, and how you can manage that. So this will help you to make the subjects more interesting. And again, as I've told you in the previous slide, planned revision. If you are not reading, if suppose you have read the topic on the day one, and then you are reading the topic, the same topic after 3 or 4 months, then obviously your first reading is not going to be helpful in any way. So planned revision is very essential. Okay, and last but not least, that discussion with your colleagues, and this is the major advantage of hostel life because you are having ample chances to interact with your colleagues during your lunch, during your dinner, while going to the college at the night time. You discuss the topics with the colleagues, that is going to be very helpful to improvise your memory, to solve your different problems, and it will also help to reduce your stress level. And certain don'ts. Don't just read for the sake of the reading. It means that okay, as today's the class is over, so I have to read the topic. Sir has said, so I am reading. It is not going to be helpful. You have to develop interest in the subject, and second thing is, as I've told you, the periodic revision is essential. So it is not possible if you read just at the time of the exam. It just increase your stress level and burden. It is nowhere going to be helpful to you. Then infrequent revision. As I've told you, if you read the topic right now and then if you read the topic after 3 months or 4 months, it is not going to be helpful. And First, you have to understand that in medical science there are two types of the we can say that the contents. There are certain contents which is just a factual uh, matter is there, and there are certain contents in which there is a deeper level of the understanding is required. Obviously, whenever the understanding is required, if you have understood the topic, it is very easy for you to memorize. But there are certain topics in which there are just factual data, you have to memorize that. Okay, so what you have to do, that the topics in which the understanding is required, you clear your fundamentals, don't just mug up the thing. And the topics in which there are factual data, in this you just revise it more and more, so over a period of the time it will uh, be very helpful in your improvising the long term memory. Okay, and last but not the least, I want to tell you that there are two essential parameters for the success in the medical education, that is integration between the different subjects, not only the subjects during the same year but subjects across the different professional years, and the discussion. Now the integration between the different subjects of the same year, it is known as a horizontal integration. It means that suppose in the anatomy, whenever you are learning say for example head and neck, at the same time you learn the same system in the physiology and the related aspect in the biochemistry. In the second MBBS, you are learning the microorganisms in the microbiology, the same way if you prepare your antimicrobial agents and like that. And second is the vertical integration. You must be aware that whatever you learn in the physiology, there is a normal physiology, there are some problems that will become in the pathology, and to treat that pathology, the different drugs that will come in the pharmacology, and overall management that will come in the medicine. Same way, the anatomy, it is going to be helpful in the ENT, ophthalmology, general surgery, and orthopedics. So this integration during the year and across the year is essential. And as again I am repeating, the discussion between your colleagues, it is also very important. So this is just a brief overview, and this is for the newly enrolled students in the MBBS. If you are having any doubt, you can ask in the chat box. And yes, very important point. Internet as a study partner. Nowadays, I am not against the using of this technology, but nowadays, suppose you are reading a particular topic, and if you find any problem, what you will do? It is very obvious for any human being that whichever the medium that is handy to you, that is mobile and internet, you just enter that query into the Google and you find the answer. Now, many a times the answer you are getting that is not authentic, and presently you are not at the stage where you can differentiate the authentic from the non-authentic source, and that's why it is better to discuss amongst your friends, you discuss with your colleagues, you discuss with your teacher, rather than just blindly follow without checking the authenticity of the source. Okay, that can be, so I will use the word that this medium can act as a double-edged sword. It means that if you use it appropriately, it will be very, very, very helpful. But if you can't discriminate between appropriate and inappropriate source, then it will be very hazardous. And presently, you have not reached up to a stage where you can differentiate between appropriate and inappropriate, and that's why avoid at this juncture. Okay, so that's all from my side. And the last sentence is here, as I told you, it is all about the long term memory. So, consistent planned approach is the key for success in medical education. Thank you very much.